symptoms of perinephritis. Fibrolipomatous perinephritis produces no symptoms. Suppurating perinephritis, perinephritic abscess, produces a clinical picture similar to that of acute renal infection. Indeed, since the perinephritic abscess originates, as a rule, in an acute cortical abscess of the kidney, it is quite futile to attempt to distinguish the two too precisely in their earliest stages. But when this acute stage has passed, chronic perinephritic abscess differs markedly in its characteristics from chronic pyelonephritis. Acute perinephritic abscess. Suppurative perinephritis is usually the result of Staphylococcus or Streptococcus infection. It results from injury or from any form of Staphylococcus or Streptococcus septicemia. It is frequently due to furunculosis. The acute attack begins precisely as an acute renal infection, but often no pus appears in the urine, the function of the affected kidney is not notably impaired, and the infecting organism may or may not be retrieved by culture from the urine of the infected kidney. Chills are common, renal tenderness and later muscular rigidity the distinguishing signs. The kidney is likely to be large and may well be painful as well as tender. Respiration and muscular movements are likely to increase it rather more than is the case with a similar tenderness within the kidney. If not promptly drained, the patient may die of sepsis. The abscess may become chronic, or spontaneous recovery may possibly occur by rupture of the abscess through the skin or into one of the neighboring viscera, or even by resorption of the pus. In view of the safety of surgical treatment, however, it would be madness to delay drainage in the hope of any such happy issue. Chronic perinephritis. Chronic perinephritis doubtless always begins acutely, but the acute attack may be so mild as to be overlooked. Like pyelonephritis, it may run a silent afebrile type characterized by an increasing mass in the loin, which is often not very tender, and the outlines of which are relatively vague. More commonly, the course of the suppuration is marked by a picket fence temperature. The patient is gravely septic, but even then he may make no complaint of his loin, and the urine may be free of pus. In adults, chronic perinephritic abscess may be quite definitely distinguished from intrarenal suppuration, though if the suppuration is advanced and the history obscure, it may be quite impossible to tell whether the pus originated within the kidney or from some other retroperitoneal source. The fully developed perinephritic abscess is fixed rather than movable, diffused rather than clear-cut in its outline, associated with relatively marked rigidity and even edema of the overlying parietes.